welcome to all of our viewers to the Ombudsman's Office program on Dayton Access TV. Tonight, we are very fortunate to have two of our staff to be helping us to talk about the topic of how we are working to end homelessness in Montgomery County. A very important topic for us all as it impacts our community in so many ways, as you all will hear about as we go through the questions that we have for our program and discuss the issues and the changes that are happening for us that are working in that community. My name is Diane Welborn, and I am the Ombudsman, and I'll be the host for this evening's program. And I'm very pleased to be joined by Jessica Jenkins. Hi, Jessica. How are you? Thanks.
Hi,
Uh,
everybody.
Great. Which she is the Director of Human Services Planning and Development Department for Montgomery County. And we also have with us Patrick Baily. Good evening, Patrick.
Good evening. Thanks for having us.
Well, yes, thank you very much for coming this evening to talk about this. And Patrick is the Assistant Director for the Human Services Planning and Development Department for the county. So, with the two of them, we're going to be able to get all of the answers to questions that any of you callers might possibly have, because between the two of them, they're going to know. This is a call-in show, as all of our ombudsman programs are. So we do welcome callers. And because we are doing this program via Zoom, when you call in to the number on the screen, it will be answered by a staff person or a volunteer at DATV, and they will send us the question and we will be able to answer it for you right after it's received. So again, welcome to all, both viewers and my guests tonight. And we've got a lot of situations to talk about. And so I'm going to go ahead and get started. Um, I'd like to have a brief history or background about the history of our work to end homelessness in Montgomery County, because it has been a topic, an issue for a number of years, and we have had a number of agencies that are working on this. So, which one of you would like to take that?
I'll take the old part of the history. I'll kind of go back
Okay.
and now tag Patrick in to kind of bring us to current. But you're absolutely right. Our community has been committed to addressing homelessness for decades. We have been fortunate to have a number of great community partners that have been investing and seeing our community address and end homelessness. And it really dates kind of formally back at least a couple decades. So back in 2006, our community, led by the then city manager, Jim Deneen, and later Rashad Young, and then County Administrator Deborah Feldman, really took the charge in saying, as a community, we need to have a strategy around how we work together to end homelessness in Montgomery County. And so through their leadership in many, many meetings, almost 2 years worth of meetings and planning sessions, our community adopted a 10-year plan to end chronic homelessness and reduce overall homelessness. And that was kind of twofold. It was necessary for our community to really get strategic around our investments to prevent and end homelessness. And the federal government said across the country to communities that were using some of their federal dollars that they had to get a plan in place, that they had to be strategic about how they were working with nonprofits and other stakeholders to prevent and end homelessness. And so together, again, as a community, in 2006, we adopted that plan. So again, over 2 decades almost ago, we adopted a plan that was, again, city, county, and United Way partnership, along with many other nonprofits, to really, again, lay out a blueprint. And they actually even called it a blueprint for our community to really take that step of what were the key interventions and strategies to really help us move forward with our community goal at that time of ending chronic homelessness and then reducing overall homelessness. Since that time, we've continued to kind of evolve that plan and take new strategies and build upon that foundation. but it really took, again, many stakeholders coming to the table. There were countless work groups and many, many hours of many community volunteers, some could be watching today, that really poured into that plan. And I think one of the biggest takeaways from the 10-year plan was that we went from having a lot of great nonprofits doing good work to serve and address homelessness to having a system. It really forced us into a system model of looking at homelessness holistically and looking at various strategies to help us make progress. And so I want to say that that foundation work still really helps guide our work today. A lot of the governing model around having a homeless solutions policy board, which Patrick will talk about, having work groups and committees, really came out of the 10-year plan work we did, again, decades ago. But it really was our community shift and a catalyst from, again, doing good work in the community to being a system that was responding to people that were in crisis and being able to help them navigate through that crisis to a place of stability. And so again, I'm really proud of our community and taking that step in establishing a plan that, again, continues to kind of guide us in some ways and allow us to move forward, to stay current with the times. And we'll talk more about what numbers look like, but that plan really has been the foundation of how our community really came together. You know, we're known for it being innovative, we're known for being collaborative, and so much of that is what's embodied in our plan that helped us think about our work to prevent and end homelessness. So I'll pass it on to Patrick.
Well, Pat,
Yeah,
thank you very much for that fine overview. Appreciate that, and we are going to turn it over to Patrick. I just want to add one little thing for our viewers is that Montgomery County really kind of took the bull by the horns with this, and counties around us did not have the same leadership and did not have the same dedication to doing this. And I think the difference probably shows. Patrick, I'd like you to get started, but you tell me whenever you're interested in showing the slides of the agencies, just say the word, and our friends at DATV will put it up for us.
okay. Yeah, so just to kind of piggyback on what Jessica said, we have a great homeless solutions policy board that, like she said, works with a lot of different homeless and housing agencies and committees. We have 6 different committees that are focused on this work, just to try to make sure that we're trying to make improvements, constantly looking for ways that we can make adjustments to further our work and to try to help folks that are experiencing homelessness. If he wants to bring it up right now, I mean, you can see the list of all the different nonprofits and governmental agencies. This is just a list of some of them. It includes most of our nonprofits, but just lots and lots of folks. Everybody from Homeful to Daybreak to Eastway to Miami Valley Housing to the YWCA to Artemis to the VA. 5 Rivers, again, that's just to name a few, and some of the systems, Adamus, the Greater Dayton Area Hospital Association, City of Dayton, Kettering. So just lots and lots of partners that we work with each and every day that are helping us provide services and helping us constantly look at what do we do, what kind of changes do we make to try to make our efforts more efficient, more effective. Again, the goal of really reducing homelessness is to make sure that homelessness, if it should occur, that it's rare, brief, and one time. We don't pretend to think in an ideal world, homelessness would never occur, but we believe that at times it probably will occur, but our goal is to make sure that if it should occur, that it's, again, rare, brief, and one time. Just to kind of talk about some of our sources of funding too. We have lots of different sources of funding that comes our way. One of the largest sources of funding is from HUD that we get. And I'm not, if I'm getting in front of you, Diane, excuse me, I can stop. So.
No, but thank you. That's very considerate of you. Yes, it's always important, I think, for us to, as Patrick did, stress that not every entity is on this slide. There are a lot of folks out there from contributing meals actually at the shelters, which are primarily a volunteer activity. So yes, in addition to the wonderful organizations you see on the screen, there are even more that are out there, and that are helping and bringing their hand to how we can do this. Patrick, I'll toss it back to you then.
Yeah, so I was talking about one of our major sources of funding being funding from the U.S. Housing and Urban Development, also known by folks that are in the field as HUD. So if I say HUD, you know what I'm talking about. But just to give you an example, in 2024, the funding that we were awarded from HUD was over $16.3 million. So that's a significant amount of funding. Um, However, I would say that a lot of the funding that we've gotten from HUD over the last several years in certain categories has been somewhat flat, meaning like somebody that got case management, 15 years ago could have gotten like, let's just say, um, you know, let's say it was $100,000, for, several case managers, but that $100,000 that was 15 years ago is not the same $100,000 that we might get today. So we've seen, some of those things have kind of remained flat, which has kind of made it more challenging because, again, 15, 20 years ago, you might have been able to pay for a case manager at 33, 35,000. Now it's probably 45 or 50,000. So that just gives you an example. Also, we use human service levy dollars to kind of supplement the funding that we get from HUD. And we also use state and local funds to do whatever we can to try to supplement the funding from HUD to try to make it go as long as we can. We're always kind of looking for, new and innovative ways to kind of, again, perform good services that kind of help folks that are, being challenged by homelessness.
Thank you. That's really very helpful. And some of the agencies that are listed just on this screen in particular bring to mind that that HUD has brought its own initiatives across the nation to help resolving the problem. There was a major effort on providing assistance to veterans, as there should have been. And I'm sure you all can, name some others that are represented, on this screen, the role, and we can say more about that, the role of mental health in the problems of homelessness. And so, they're important. And then, of course, at the root of it all is that the need for shelter, the need to have a place to rent, a place to live. And so Greater Dayton Premier comes in as our most reasonable source of housing options. And would you all like to add more about these agencies or the initiatives that they represent before we move on?
Oh, no, absolutely. You highlighted a couple of great ones. And just a point Patrick mentioned again, this really is a combination of funding sources that makes this system happen, right? So there is public and private partnership that really allows us to leverage this system to make an impact around the area of homelessness. As Patrick mentioned, for a long time, funds had been static, but actually in this last competition, HUD added dollars to kind of do a cost of living increase, which is one of the first time in decades that happened. So we see that as positive momentum and, again, a recognition for the important work happening at these nonprofits. So I wanted just to go back and underscore that point. But I'm so glad you mentioned veterans. The HUD, as well as the U.S. Department of Veteran Affairs, have been committed around making sure that there is not a single veteran in our country that experiences homelessness, because they have served for our country. We should be able to make sure the right resources are in place so that they never have to experience a housing crisis. And so back in 2016, actually, we were one of the first communities to declare a effective end to veteran homelessness. And as Patrick says, it doesn't mean there's no homeless veterans. Unfortunately. But what it does mean is that we've committed in partnership with the VA, with a number of these nonprofits like Volunteers for America and St. Vincent de Paul, Homeful, and others to make sure that when a veteran experiences homelessness, that it is in fact rare, brief, and one time, that we're identifying that veteran through outreach services, understanding what that veteran's need might be, and then getting that veteran connected back to permanent housing. One of our great partners in this work is also the Housing Authority, GDPM. There's a special VASH program that's a specialized housing kind of subsidy, a special Section 8 basically just for veterans that we're able to, again, leverage to help those veterans in that housing crisis and maintain permanent housing. So proud of the work that we've been able to engage in with so many partners on this slide around, again, working to make sure that all of our veterans have a safe place to call home. It's, really important that, again, they served our country, that we be able to serve them and in turn for their service and making sure they don't have that housing crisis. Another special population that HUD, again, and as you mentioned, Diane, have been aligning their priorities is around youth homelessness. And I'll let Patrick talk about our work to prevent and end youth homelessness.
Yeah, over the last few years ago, we were awarded 3 youth homeless demonstration projects, and that's for youth that are 18 to 24. One of them was to Daybreak, and Daybreak's project is a rapid rehousing project, which basically helps youth that are experiencing homelessness quickly secure and maintain stable housing so they can get that housing quickly. It's also, the one thing that's nice about their program is it really provides some flexibility with financial assistance to help youth. Of course, they've got like case management and supportive services that are really tailored around that individual youth specific needs. So it's not a cookie cutter approach. It's really approach trying to address each youth and what kind of challenges that they might be facing. And HUD in our community realizes that the challenges that one youth faces is not the same challenges that another youth might face. And then we got 2 other programs that were funded by HUD for, again, the YHTP programs. One of them was Homeful's Diversion Rapid Resolution Project. And basically, that rapid resolution project is basically every youth that comes into the shelter, they're trying to do a crisis needs assessment right away to try to help identify safe and immediate alternatives for that youth. So sometimes it might be mediation services where like they're trying to do mediation between like maybe the youth and their family, because maybe there's an argument or maybe there's something that occurred that is the reason why the youth is now homeless, family reunification, and then again, sometimes short-term assistance, because again, youth might have different needs. Maybe they wouldn't be homeless if they were able to stay in their aunt's house, but the aunt is saying, hey, I can't afford to pay all the food for you. They might be able to give them some short-term assistance to help with food, So that is the Homeful's Diversion Rapid Resolution Project. That is the second one that we got. And then the third one is Homeful's Coordinated Entry Project, which is really focused on a centralized intake system that ensures that all youth that are experiencing homelessness are quickly connected to the most appropriate services and housing and supportive services that is out there. So each youth is assigned a system navigator that kind of guides them and walks them through that process. So, we were super excited a few years ago when we got this funding because it means that we can, again, like Jessica said, we got some targeted funded for the veterans. Now we have this targeted funding for youth. We can try to really focus on this population and do what we can to try to best serve this population with all the different challenges and stuff that are coming their way.
Thank you, Patrick. Appreciate that. It's I think the next slide we'd like to bring up after we answer a caller's question is this one. They're ahead of me, which is just fine. But one of our callers, not surprisingly in this time of controversy, is asking if there are concerns about whether or not this funding you all have been describing, which has been very important, will experience a drastic reduction. I'll let you all comment as best you can, realizing it's a little bit of foretelling of the future.
It's an excellent and timely question that, again, we've been monitoring closely. There's always, whenever an administration changes, there's always an opportunity for a change in funding, and especially, given what we are watching and tracking in the media with the eye towards efficiency. We do recognize that the funds that we have around homelessness could be at jeopardy. Or in jeopardy, but I will say from the past administration, there was continued support for these programs in our community. And so we have a little bit of that as a past history to hope that, again, our strategic use of these dollars helps make the case for why, again, this is the right investment. As you mentioned, Diane, affordable housing remains the solution to homelessness. And as long as we, remain vigilant around advocating for the need for these resources, I think that hopefully makes that case. But again, we are closely monitoring the HUD allocations that we have for these programs and others, as well as talking about the need to, again, have that cross-sector partnership. Again, we know that no one bucket can solve it all. It can't just be the government dollars or the nonprofit dollars or the philanthropic dollars or the faith-based. It's got to be all of our resources together with a shared goal. And so our hope is that if there are obstacles encountered in terms of reduction in funds, that we continue to work as we have in the past as being collaborative and innovative and leveraging, again, as you mentioned, Diane, our work touches so many other systems like our Alcohol, Drug Addiction, and Mental Health Services Board, like our workforce team. I mean, we have that opportunity again to reimagine how we resource some of our solutions. So I think while this will be a challenge if we do experience cuts, we are preparing ourselves now for those impacts and having those conversations early around how we continue to make sure things are covered as we go ahead.
Thank you. Thank you so much. The next item I'd like us to turn to is the actual numbers of individuals or families experiencing homelessness in our area. How do we find them? How do we know about them? Let's talk about some numbers, because I don't think it's something that is seen very frequently. There are a lot of communities. I think our viewers, and many of them may have visited communities where they see people and tents and encampments and things that are not usually present here in Dayton, Ohio, as people drive to their work every day. But let's talk about what the numbers have shown to us recently and how we get those.
So I appreciate the slide here. What you can see is that in 2023, we had 506 people that were homeless. That amounted to a little bit over 4,100 households that were homeless. And as you look at the chart, you see that like in 2019 it was at 3,791, and then you see where it kind of dipped down. Well, we saw a lot of natural dips during the COVID years in the homeless sector, and so that's kind of what you see there in 2021, and then you see in 2022 it's starting to move up a little bit, and then in 2023 definitely into that trend line. So unfortunately, homelessness is increasing. But what was mentioned before is affordable housing is a key ingredient to ending homelessness. And that's a really important factor as we try to, again, fight against homelessness and try to help folks not end up being homeless. So again, those are some of the annual stats that hopefully is helpful to you and the folks that are watching the show.
And just a point of context, thank you, Patrick. So how we define this, really are a few populations are included in this number. So as Patrick shared, unfortunately, this number is increasing, but we measure this based on people that have spent at least one night in one of our emergency shelters. And we have technically, 4 of them. We have the Apple Street Shelter for Women and Families. We have the Gettysburg Gateway for Men. We have the Daybreak Youth Shelter and the YWCA Domestic Violence Shelter. And then in addition to those who stayed at night in shelter, those households that were working with one of our outreach workers, so Miami Valley Housing Opportunities or MVHO, their PATH program also works with people that are unsheltered, maybe staying in an abandoned home or in a place not meant for human habitation like a park. And so that's how we come to this number. So it's important maybe to give context to our viewers that this number really is measured in a kind of a specific way. It is those folks that were at least one night in a shelter or had at least one contact with our outreach workers. So that's how we're able to kind of come up with a firm number on kind of what homelessness looked like in Montgomery County for our community. We report this information annually. We're just a few months shy of when we'll report our 2024 data, but we are fortunate, again, to have a homeless management information system or HMIS system that all of our providers provide data into. So that, again, allows us to have access to ensure data is unduplicated and is comprehensive in the people that are coming through our system experiencing homelessness.
Very good. And then also, there are times annually when individuals go out into the community to actually count. And maybe you'd like to say a little bit about that. It is a once a year event, I believe.
Sure, and that's you're referring to the point in time count. It is one time a year. It's a HUD requirement. Basically, every continuum of care across the country in the last 10 days of January are going out and doing this point in time count. They are not only looking at folks that are counting the folks that are in the shelters, but they're also counting folks that are unsheltered. So they're going out that night, looking for folks sleeping in cars, vacant buildings, tents, any place and every place. They use the PATH team quite a bit because they are they're out in the community a lot to kind of give them a sense of where they've seen folks. Then in addition to that, HUD requires that we count folks that are also what's considered transitional housing, which is, temporary housing, or also the housing, safe haven housing, which is housing for folks that have severe mental health issues too. So that's how we do the point in time count. There's a lot of work and effort that's done. I think this year there were 6 different teams that went out that night to try to go out to all the different potential locations that they were aware of folks that are homeless, that are residing in places that are uninhabitable.
Okay, thank you very much. The phones have been busy for us, so we're going to turn away from some of my questions for a minute and get the questions that the public is asking, because after all, that's one of the major reasons we're here, is to get people's inform them and let them know. One is asking, are there plans to create housing options? And they are asking specifically about single room housing options in order to help counteract the rising cost of housing and to rehouse people. So either of you that wants to take that one, please go ahead.
Love the question, and it's absolutely spot on. Again, as we've already shared, that the answer to homelessness is affordable housing, is right, having the right set of housing options. And housing affordability has totally kind of gotten out of whack with people's wages and access to those types of units. So we are, and that was just, again, a perfect segue without even, knowing who put the question in there, that we are absolutely looking at different housing models. And yes, the single room occupancy or SRO model had been in vogue for a long time, right? It was an affordable way people would rent a room and be able to have, that safe, affordable place to live. Maybe a decade or two ago, we kind of started to convert SROs to efficiencies in 1-bedrooms. There was a pattern towards that, but we are now having conversation about how we reintroduce SROs and things like tiny homes. We have several nonprofits that are really interested in looking at tiny home communities as a way to also be a housing option within our continuum. So yes, the person that asked that question, you were hitting the nail on the head in terms of we are starting to go back to looking at those more creative solutions to housing that is within that affordability range and that can be created relatively quickly from a development standpoint so that we can have more units available to people that are experiencing a housing crisis. So great question. Thank you for that.
Well, thank you for your answer. And I'm not going to ask the question, but I bet you would be happy if you heard, as a result of our conversation here, perhaps from some landlords that have some places available
Absolutely.
for individuals. Another caller is asking us if there can be some elaboration about the connection between mental health, mental illness, and homelessness.
Yes, certainly. And I think I'm happy to start, and until Patrick will add to the conversation. But when we talked about, our plan, decades ago was around ending chronic homelessness and reducing overall homelessness. And that chronic homelessness piece really spoke to the connection between mental health, substance abuse, and housing. For folks that really kind of get stuck in homelessness, often there's a connection between their mental health or a substance use disorder. And so one of the major interventions for that kind of intersection is what we call permanent supportive housing. And so one of the big solutions of that plan and our continued strategy is creating housing that both connects people with mental health or substance use with services to make sure that they're able to keep that stability and maintaining their home through connection to, if they so choose it, behavioral health services, substance use services. And so there absolutely can be a connection, especially for those that really struggle or get stuck in homelessness. Again, that's that chronic homelessness piece. And so our solution for a lot of people that kind of find themselves experiencing both mental health crisis or substance use disorders and housing instability is to create a supportive housing environment where those supportive services are available either on site within that housing program, or they're linked then with community-based mental health services, or a combination of the two. So there absolutely can be a connection. And we know that, again, we believe in a housing first philosophy. That means that really housing is a basic human right. And so the housing solution is paramount, but that often the supportive services to help someone become successful are also equally as important. And so we work to make sure that when someone experiences homelessness, that our solution is always going to be one that provides them with connection back to housing, but often if they have a mental health challenge or if they have a substance use disorder, that we're also supporting them to be successful in the long term, which means connecting them with those behavioral health or those substance use services so that they can have that long-term stability in housing.
Right.
Yeah,
Thank
and
you.
just to
Patrick,
add
go
to
ahead.
that, our MVHO's PATH program, they deal, pretty much exclusively with folks that are unhoused homeless folks. And there's a number of them that do have mental health problems. And so they are trying to, connect them to services. They're trying to do, assessments with them so that they can get them in line to be eligible for housing in the community. As like Jessica said, we recognize that there are issues and there are connections with mental health and substance abuse and homelessness. And PATH is a great example of one of the agencies in our community that really does a lot of outreach to that group and tries to help connect people to services.
Thank you. I'd like to ask, is it time, do you think, now to remove the numbers screen and return to our conversation? Is that okay?
I think
Okay.
that would be.
Sounds good.
Then we'll take that slide down, but thank you for bringing that. It's always the question, how many are there? There's been, I believe, a lot of research on the topic of homelessness because it is all over our country. There are very few communities that have been spared from families and people. With all of this research, would you like to take a stab at, and you already have touched on it, I think, on some of the major reasons for homelessness?
I'll start off by just saying, and reiterate that, the lack of affordable housing is a really big driver for folks that end up being homeless. Just to give you and the listeners an idea, in our community, and really we've seen the same trend in many areas across the country. Rents have risen very quickly, very fast. Pretty much from 2010 to 2020, rents were relatively flat, modest increases from year to year. But once we got to 2020 to 2024, we saw, the fair market rent in our community go up by 34%. And when you think about that, you think about who, the average person who gets a 34% increase in their wages over 4 years, not very many people that I know, nobody that I know actually. So when you think about that, that's significant. And if you already have some folks that are on the bubble, if you already have some folks that are just kind of, you know, struggling to get by, you have a 34% increase in rent. And just imagine what that, there's just no room, if they had a little bit of extra money before, most likely they don't have that money, now. And then sometimes it becomes, well, what do I pay? Do I pay for my prescriptions? Do I pay for my rent? Do I pay for food? Do I pay for clothing for my kids? They have all these different choices, and none of them are really good, to be honest with you. They're kind of between a rock and a hard spot. So I think that's, one of the key and critical things. I think obviously folks that, if a person loses a job, that can be really, difficult. And if there's not a lot of jobs that are available that are, wages that can pay for that increase in rent, again, that creates a lot of issues. Then sometimes individuals and families unfortunately end up homeless. So those are a couple of the things that just come to my mind. But again, the fair market rent has been a huge problem all the way across most parts of the country over the last 4 or 5 years.
And just to put a finer point on Patrick's part about housing affordability, we lost thousands of units in 2019. I know it feels like it was forever ago, but that really was a hit to our affordable housing kind of ecosystem. A lot of those units were naturally occurring affordable units, and when they went away in places like Trotwood and Inglewood and Riverside, it made an impact on that housing affordability. There was fewer units, and so landlords were able to increase prices. And so I want to just name that because research is important, but also just our local impact has shown us from local data that the lack of housing also has been able to drive up pricing, creating that larger gap between wages, as Patrick said, and the affordability of those units. And then also, I think Patrick mentioned it kind of towards the end of his remarks, is that, one of the other components is social connectedness, right? A lot of people that end up kind of encountering our shelter system or unsheltered, it comes from, they kind of burn bridges. And so that's why Patrick talked about some of our interventions now, like diversion or rapid resolution, talk about restoring some of those familial conflicts or conflict resolution really now are becoming part of our housing problem solving strategy. It's no longer just rental assistance. It's how do you repair relationships? Because really stability and longevity come from, I don't take credit for that. I know some of our nonprofits like St. Vincent de Paul have also been talking about really how do we bring those social supports back to people as they reemerge from homelessness, because that is, also really important. There are people that every day encounter mental health or have substance use that never become homeless, right? Often it's this lack of social connectedness and support that really have people unfortunately get stuck in a cycle of homelessness.
Well, thank you very much. I hope that enlightens many about the multiple factors of the causes and the complexity sometimes of what we need to do. I am I'm watching my time here carefully, but there's some questions I really want to get to. And one is to ask either or both of you to describe the role of the faith-based community in serving those who are homeless and helping them move away from homelessness.
Patrick, do you want to start? You want to?
Sure. Yeah. I was just going to say that, I believe that the faith-based community has a significant impact in trying to help us address homeless folks' needs. We have many faith-based organizations that help volunteer, provide food, provide clothing. St. Vincent de Paul has a lot of their parishes that are involved, with trying to help folks in the community. And they also, when you think about it, a lot of the different local faith-based churches and so forth, I mean, they have contact with lots of different people, across all the different communities in our area, and so they can be a great link to resources, trying to keep them informed so that they can make good referrals to try to help somebody who's struggling. Maybe somebody needs help with food, they can point them to some close food pantries. In fact, some of them have them even in their own churches. So there's a number of things that, like, a lot of the faith-based organizations in our community do to try to help folks that are experiencing homelessness.
Thank you.
That was what I want to add. One more little plug, though. I think what Patrick said is 100% true, but I want to say too that often the faith-based community can do things that government funds can't do. So I think about places like Westminster that has an ID ministry. They can easily help people have the time to get those IDs that often take months, in some cases years, to obtain. And so we're so grateful for that nonprofit, government, faith-based partnership, because again, often their resources can be a lot more flexible and can help meet needs, often sometimes just faster than government can move. So grateful for those partnerships.
Yeah, thank you. Thank you very much for that. And then after so many years of addressing this topic, I think in the beginning you took that history back a long number of years. Do you think that there is a greater level of understanding? And let's talk about Montgomery County rather than across the whole United States, or we'll be here all night. But let's talk. Do you think there's a greater empathy, sense of understanding, a sense of community wanting to help and be more understanding of these situations than what we might have found in the past?
I think it ebbs and flows, frankly. But I do think, given so many of the recent circumstances like COVID, like the job losses, I think people are closer to the issue, whether they've experienced housing instability or they themselves have had a hard time paying their rent. They may know someone that either slept in their car some nights or had a loved one that was at one of our shelters. So I think, just given the kind of challenges we've encountered as a community over the last several years, I do feel like there's a sense of people are closer to the issue. And sometimes that leads to empathy. Sometimes it doesn't. It's not always a one for one. I can say that sometimes there's still that prevalence or prevailing thing that people should just figure it out or use their bootstraps. And often we know that there's so much more complexity to the issue of homelessness. As I mentioned, there's substance use, there's mental health, there's social connectivity that also drives someone's experience to be longer if they're experiencing a housing crisis. But, I do think that people have a better understanding that, often people aren't that far away from, again, whether they're having to move in with a loved one first or kind of getting closer and closer to that place of housing instability. But, it varies. Again, the attitudes that we hear sometimes can still be very, critical. And so we do a lot of work to kind of remind folks that, again, housing is a basic human right, and that we work to make sure that that is the case for everyone that needs it in our community.
Thank you. Thank you very much. And I also wanted to see if you could clarify a bit about the impact and how our community is trying to ameliorate the impact on children of experiencing homelessness.
Yeah, that's a great one. And Patrick, you're welcome to let you jump in, and I'm happy to pick up where you leave off.
Sure. I mean, I think that there are a number of things that we're trying to do to try to help folks that are the children that are in the shelters that are homeless. For one, we have a children's services worker that is embedded at the Apple Street shelter, which is the women and families shelter. So that person's trying to work with those families and connect them to resources and help them on a regular basis. One of the other things that's nice about the Apple Street shelter is that they've got the Five Rivers Samaritan Clinic that's on site there. So if you've got a child that's got any health conditions or something, they've got somebody there that can kind of work with the child and the parent to try to address those situations. There's also like a number of kind of like, I guess I would call one-off things that they do at the shelter to try to make things, I guess, easier on the kids. For instance, they have a school bus that picks up the kids at the shelter, but they make sure that school bus that those kids at the shelter are the first ones picked up in the morning and the last ones dropped off. And they do that on purpose to make sure that other kids don't know where these kids are coming from, because they know that, at times that, folks cannot be very nice, and there can be teasing and taunting and things like that. And so it's done strategically to try to, help those kids. They also even, at the shelter, they try to have a separate meal time for the families as well. So it's a separate setting and mealtime for the families with the children, so that they can kind of have their own designated space at the shelter. And then one of the other things that one of my staff remind me of is that they also sometimes do special events for the kids, like around the holidays and stuff. So they try to look for ways that they can do things with the kids. And then lastly, they really try to work with the families to make sure that that their needs are being assessed and that they're being prioritized for housing too. So they try to get that done so that they can get them in line for housing as soon as possible. So those are some of the things that I could think of with the children, what they try to do specifically with children that are involved with folks.
Thank you. Thank you. That's very helpful, and welcome that focus, of course, on education. I've got a couple of callers here, in addition to my own questions that I'm not finished with, but one caller wants to know if a person or a family is not happy with what's happening to them or with them at the shelter. Who do you suggest they contact? Well, the person's calling the Ombudsman's show, so that's a good start. But there are others within this. We're not the only resolution. So let either both of you take that, please.
Yeah, no, that's a great question. And absolutely, you're right. The Ombudsman's a great place to start. But both the city and the county are supporters, funders of the St. Vincent's, the two large shelters, the one for women and families and the one for single men. So either of those entry points are appropriate places if you have a specific concern you want to have addressed. Our office, which is the Human Services Planning and Development Department, is happy to field that concern or complaint. In the city of Dayton has a similar department, planning and neighborhood services, that could also take that complaint and get back to you with a resolution. And then certainly if, depending on the concern, there are grievance policies within the shelter. So sometimes, unfortunately, depending on where that complaint sits within the organization, sometimes they have leadership too that can help resolve an immediate concern. So we do want to make sure that all those lines of communication are open. So if you're able to and feel safe talking to the shelter leadership, that's a place of entry. The Ombudsman and the city and county are also places where you could share your concerns so that we can follow up and address them.
Thank you. And another caller has given us the question about the relationship between huge medical bills and the creation of homelessness. I mean, we've seen in the days of foreclosures, the relationship between medical bills and foreclosures. How would you all speak to medical bills and homelessness?
I mean, any kind of major financial crisis, so medical debt, divorce, those things can certainly be an impetus for housing instability. And so that connection is absolutely one that does happen and is something that, again, as people come into the system, we're working with them to understand kind of what led to that circumstance, to figure out how we can pair them with, debt alleviation, or how to kind of work with them to get some of that debt erased so that they can get ahead. Again, the goal for us is to get folks connected with housing and to promote that stability. So it's not enough just to get them into a unit, but it's to figure out how to address whatever got them there in the first place. And so often if it's things like huge amounts of debt, working to get some of that debt canceled are parts of the strategies that our case managers work with individuals on, because absolutely, major debts like medical bills that are not paid or covered by insurance can lead to a level of housing instability that can result in homelessness. Yes, absolutely.
Very nice. Go ahead, Patrick. Thank you.
I'm sorry. I was just going to piggyback on that. I was going to say that, moving forward, the case management staff can try to help folks, apply for Medicaid and get on Medicaid, so that moving forward, they don't have that same problem. Hopefully they can kind of help walk them through all those different pieces and components so that they can get on medical and not have that issue as they, move into the future. So.
Thank you. And then we also want to know, what do you all recommend that the public can do to assist in these efforts? And to where would you direct people who are interested? You've mentioned a few, but I don't know if we have any central clearinghouses, or what you all would say is the are some of the places that you would send people who sincerely want to do something to help.
Some of the things that I can think of, as far as funding goes, is advocating with the local, state, and federal legislators. They really, the more folks that can kind of share the needs and the concerns that we have in our community, it can make a difference in the type of funding that we see, now and in the future. I think also, as far as what they can do, there's lots of different opportunities with a lot of the different organizations that we showed on the screen before, that have opportunities to volunteer, to try to help different agencies, whether that's, monetary donations or physically going and help or serving meals, or whatever the case might be. There's, lots of opportunities that folks could have along those lines. Those are the two that kind of came to me. Um,
I would just
Thank you.
add to that. I mean, Patrick's office supports a continuum of care group that gets together at least twice a year for those that are interested in helping us prevent and end homelessness. And so if people are interested in coming to the table, think about strategies to, pursue opportunities for additional resources at the, state and federal level, as well as other philanthropic resources. That's a table that comes together at least twice a year, again, to problem solve and tackle around the issue of homelessness on our website, which is www.mcohio.org/HSPD. Under the Homeless Solutions tab, there's a sign-up form if you're interested in joining the continuum of care. We send out regular emails about funding opportunities around, again, our data presentation will be an open invitation to the community, including that group. So we welcome folks that are just interested in being a part of the solution to join the work through the continuum of care as well.
And thank you very much. I'm afraid our time is rapidly flying, so I'd like to give you each a moment for your own thoughts and comments, what I may not have already covered, or ask you that you really need to say. So I'll start with Patrick and end with Jessica, if that's okay.
Sure. I mean, I think what I would say is that, our community, like we mentioned before, has a lot of different funding that helps folks that are experiencing homelessness. We talked about some of them. We talked about the grants that come from HUD. HUD also at times have grants that are special grants, like the COC Builds grant that came about last fall, which was again an effort by HUD to help expand permanent supportive housing, which again Jessica talked about the role of permanent supportive housing and trying to help folks that are considered disabled and might be challenged with mental health, substance abuse, and that type of a thing. Again, our Human Services Levy, I can't pass up an opportunity to plug the Human Services Levy. The Human Services Levy also does play a role in helping, fund services for folks that are experiencing homelessness with the shelters and a lot of different other, specific funds, again, to try to help cover the gap that we have seen in our community. So those are the few things that I just wanted to touch on that I hadn't had a chance to talk about.
Thank you very much. We appreciate those important contributions. Jessica.
Yeah, those were great. And so I just want to maybe end my comments with a little bit of a public service announcement. There may be a little bit of confusion about what's happening around our shelter system, particularly around options for single men in our community. And so I want to make sure that I leave with being really clear with the community that while we're changing the operator of the men's shelter, St. Vincent de Paul has decided to no longer operate the men's shelter effective the end of June 2025. We will have a new operator in place prior to June. And so there will be a continuity of services for single men in our community. I know in different spaces I've heard confusion about the shelter for men closing. And so I want to just be sure that the community knows that we're committed to having a safe place for our men that are experiencing homelessness. And even with that transition happening this summer, we will have a shelter in place for men in our community that are experiencing homelessness. So again, so grateful for the questions tonight, the interest in this topic, because again, we really know that this is important for so many people. There's so many reasons why, again, folks care about this issue, but we're just proud to have such a great community that's collaborative and the work to help prevent it in homelessness here in Montgomery County.
Yes, thank you very much. I would like to thank both of you for your time and sharing your knowledge and expertise, and in such an encouraging way, and helping to educate our viewers. I'd like to thank the viewers tonight. There was a lot of participation, and we really appreciate and enjoy that, enjoying hearing your thoughts. So thank you very much. And so good luck to my guests in your challenging work, and good night to the viewers. Thank you very much. Bye.